World Health Organization's vaccine experts have revised their global COVID-19 vaccination recommendations, and healthy kids and teenagers considered low priority may not need to get the shot. The updated roadmap is designed to prioritize COVID-19 vaccines for those at greatest risk of death and severe disease. This is according to the World Health Organization's Strategic Advisory Group of Experts on Immunization.
According to CNN, this update is being issued to reflect the Omicron stage of the pandemic, and because of countries' high population immunity levels due to vaccines and infection, the group announced following a recent meeting.
So this is very interesting. So they're saying, so their new ranking is like a high-risk group, a medium risk, and a low-risk group, and they said otherwise healthy kids and teens. So if you don't have an a health condition, a compromised immune system, they're saying you may not need this shot. You are at low priority. So this is just reflecting a wisdom that most people have by now, which is that the vaccines are most important for the elderly and for the immunocompromised because they don't stop you from getting COVID. They help you have a less rough bout of COVID, particularly if you're in one of those groups and if you've never had COVID before. The first bout with the disease tended to be worse. So that's all well and good, and recommendations should follow that, and strategies for getting people vaccinated should follow that. But other countries, including the U.S., had for a very long time really everybody get vaccinated, everybody get booster shots. Most vaccine mandates have fallen by the wayside by now in the U.S., but they're still U.S. colleges and universities. Many of them are the most vaccine mandated places you can find in the entire country, aiming at the population that would substantially be considered low risk by World Health Organization recommendations.
Yeah, the longer this goes on, the more it is clear that so much of the rationale behind COVID policy hinged on the idea that getting vaccinated meaningfully decreased your ability to transmit the disease.
Yeah.
That's it. The second that goes out of the window, one, you're in a more every man for himself kind of situation where it could be very, very advisable for you to get it because maybe you are at an at-risk population, or maybe you haven't gotten COVID and maybe we're experiencing a strain of the virus that was putting a lot of people who are otherwise healthy into the hospital. But ultimately, that's a personal decision. You can weigh the risk rewards without there being any broader social impact. But the second we got into a place where they weren't able to prove that taking the vaccine didn't keep grandma alive, it didn't make sense to keep athletes out of the country because they might spread it at a tennis event, none of that mandatory stuff started to make sense anymore. There should have been an acknowledgement and a kind of hard pivot away from it. And to this day, I still end up having conversations with people where we disagree about COVID policy, principally because they still don't understand that the promises of diminishing transmission never came to fruition, or at least no longer come to fruition now that we're in several strains down the line of the cycle. And that's a problem.
And I'm looking for more acknowledgement from the camp of people who said, why aren't we listening to the science and to the experts? Well, the science and the experts disagree, and scientific experts in our peer countries, in the World Health Organization, are we supposed to be taking their advice seriously as well? It's only listen to like Dr. Fauci or Rochelle Walensky or something? No, the premise was always we're supposed to listen to. In fact, in the Democratic coalition, there's a kind of international consensus sort of model, right? What are the global health experts saying? And what they have said on vaccines, we're becoming a kind of outlier in terms of how much vaccines for everyone at all levels is the strategy. That is not what our peer countries are doing. That's not what the World Health Organization says. And a lot of what we're doing on that front has fallen more by the wayside as there's more, we're not firing government workers anymore for not getting vaccinated, that kind of thing. Although we are, putting the vaccines on the vaccine schedule, which will have the effect of requiring them in some schools and also decreasing liability if there's anything of that nature.
Yeah.
So we will be in a situation, not everywhere, but in some parts of the country, where we're requiring vaccines for young people, requiring boosters, they're requiring the bivalent booster for students at the campus I graduated from, the University of Michigan.
I would like to see a lot more free testing kits. I would like to see a lot more high quality masks distributed and made available in public places. I was on a walk recently and realized I had to get home faster than I thought, and I had to get on the subway and I didn't have a mask. And things like that actually have a relationship to preventing transmission. I would like to see those things being provided to the public for free if there really is this public health interest in stopping the transmission of this virus. However, these policies that are not well tailored to actually doing that, at a certain point, what I would really love to see is some public health officials going on TV and making a really clear statement about what we know now about COVID and transmission all these years later. I do think that there is some evidence that on the margins, being vaccinated does lower transmission because it keeps your time of having COVID shorter. And so you're infectious for a shorter period of time. The statistical significance of that, I think, is at issue.
Right.
And so I would genuinely love some clarity about that. Is if there's any reason to still believe that transmission is meaningfully affected by vaccination, I want to know. I don't have the dog on this fight. But my understanding at this point is that that is not the case. And there is just such a wild disagreement in the public about that because there hasn't been a statement made from on high. Hey, we were wrong about that, or the scenario has changed, or the virus has mutated and it's no longer that. That is what's causing so much of the friction and anger in this country.
And we're in a place where the overwhelming majority of people, not everyone, but the majority of people have had COVID at least once. Many people have had COVID twice. And we know now, even though this idea was very much stigmatized by the health authorities to begin with, that having been infected with COVID does have a protective effect in the ballpark of the protection you're getting from the vaccine. We don't know, how long it lasts, that kind of thing. We don't know if it
which
an
we
earlier
should know.
strain.
They should be studying
those are the
that
questions
stuff.
we have.
Yeah.
But I think they tell you if you had COVID, don't get a shot right away.
Yes.
Wait,
I mean, we know it protects you for some period of time, but the question is, now that we're 3 years into this thing, it's like, does it protect you for 6 months? Does it protect you for a year? I'd be open to getting another booster, but if no one seems to have a clue as to when it would be advantageous, our health system being what it is, I'm not going to schedule a doctor's appointment, take time out of my day and my life, and all of this stuff without some clear indications as to what is actually indicated. It is wild how we went from having alerts on our phones and special updates on the TV and all of these, you've been exposed alerts and things like that, telling us what was going on with this pandemic, to basically radio silence. Truly, I cannot emphasize enough how much I think that the tensions over COVID are largely because of a failure to acknowledge changes in what our understanding of the disease from the CDC.
Yeah, remember when the experts all said breakthrough cases are going to be rare? They're going to say you're going to hear about them and that's going to make you think the vaccine doesn't work. Yeah. But it is working. There will be breakthrough cases, but then everyone got one. That turned out not to be true.
But it's liberals who, I know there's a lot of vilification of, you're a liberal and you're a Democrat and you were COVID shaming. I think that a lot of that was true. But to the extent that there was people who still believe this stuff, it's not because they just want to believe it. I'm telling you, I have conversation after conversation with people who genuinely don't know that there has been any factual shift in our understanding of this virus. So they're not sitting around just saying, I hate Joe Rogan and ivermectin, and so I want to keep boosting to the end of my days. They legitimately don't know that the vaccines aren't offering the protections that they were offered. And that's the kind of misinformation that needs to be addressed.
Yeah, it's very on that topic. It's very interesting what kind of misinformation is what gets addressed. My own reporting on social media censorship, there were a lot of claims that the CDC talked to social media companies about and pushed them to suppress. Now, some of these claims relating to vaccines, I think, were inaccurate claims, but their rationale for doing it was often, we don't want to discourage vaccination, including of children. That was in some of the emails I reviewed. That was their reason. Again, I didn't mean the underlying claim was necessarily accurate, but what they're saying is, you can't allow any criticism of vaccines because we don't want to stall any of the political momentum for childhood vaccine mandates. And that looks pretty short-sighted to be moderating on that basis now. More Rising right after this.